Tell me what exactly ages our face the most?
Fear, anger, irritation, all of that gets imprinted on the face.
Osteopathy is some kind of pseudoscience.
I can work with the pelvis, I can work with internal organs, and the face starts to lift.
You don't use Botox?
It's a controversial topic.
What can you do about snoring? Osteopathic practices can influence libido levels and even orgasm, right?
With exercises, you can solve all these issues.
I feel like stretching and working out right now. Dear friends, hello everyone. Today I have an amazing expert as my guest. This is a doctor whom I've known for a very long time, followed for quite a while, and who, in my opinion, is a truly valuable specialist. I've never had a guest with this kind of specialization on my show before. Alice Ulishchenko, doctor, candidate of medical sciences, osteopath, orthopedic surgeon, traumatologist, and plastic surgeon. Alice, you have so many different titles, but most people and our viewers know you primarily as an osteopath. Hello, thank you so much.
Hi, yes, I'm really glad to be here.
You came to visit me. We have an incredibly packed conversation today. I have 55 questions.
I'm ready. Hi, everyone. Yes,
The topic of osteopathy is very relevant, but yet not well understood, since many people still think osteopathy is just something like you place a finger here and that's it. No, our story is different. Your patients had amazing results. So please tell us a little about yourself. Who are you? What do you do? What are you all about? How do you become an osteopath?
it's hard to say in just a couple of words who I am, right?
No need to keep it to just two.
My name is Alice Ulishchenko. I'm 35 years old. I'm an osteopathic doctor, and I also specialize in traumatology, orthopedics, and plastic surgery. I defended my dissertation for the degree of candidate of medical sciences. And for the past 20 years, I've been continuously learning. Even though I'm an expert and currently practicing, was even invited to your podcast, I'm still constantly studying. So, listen, my field of interest includes everything related to body oriented therapy, primarily osteopathy, as well as everything connected to biochemistry and maintaining the body's homeostasis. It also includes psychosomatics, psychology, and even, I would say, spirituality, the spiritual realm. I realized that to be truly healthy, one must be a harmonious person. And in order to be a harmonious person, you need to achieve balance in these four areas.
But you're a doctor, a PhD. What do you mean, spirituality?
The more I delve into the study of neurophysiology, the more I come to a realization that many things, even esoteric and spiritual ones, can, in essence, be described through certain biochemical and neurophysiological processes.
You've gone through such a unique journey. As a colleague, really, you inspire and amaze me. You went from being a surgeon, a traumatologist, a plastic surgeon, and now you've come to osteopathy. Why did you leave surgery?
Well, for a while, had a long-standing dilemma because I actually liked surgery, and I was a practicing surgeon for almost 6 years. And during that time, I also defended a dissertation in surgery and obtained a specialization in plastic surgery as well. But since I started my journey into the study of holistic healing methods very early on, that is, integrative approaches to health, the understanding that the body is not just a collection of parts, you can simply twist, remove, or insert, but rather a living ensemble of all processes. And it's very important to approach the body as a unified whole and to focus not primarily on eradicating disease, but on seeking health, its deeper approach. That is, to seek out the resource, the vitality through which everything begins to come alive and flourish. And I began my journey back in school. So by the time I was already working as a surgeon, it had become a life philosophy for me, and I simply couldn't give it up anymore. Surgery, was taking up more and more of my time. And at some point, I just realized that I had to make a choice in order to become truly good at something, right? And that's when I realized by then I was 29 years old and had just defended my dissertation in surgery. At that point, I decided to set it aside. At the same time, I'm not closing that door forever because
Working with your hands.
working with my hands, that skill stayed with me, and maybe I would still be performing surgeries, but I believe that right now I'm doing something more important for myself and I'm able to help more people.
Many people think that osteopathy is, well, pseudoscience on the one hand. On the other hand, many people believe it's a method of alternative treatment. Let's explain it to our viewers. My audience likes it when everything is laid out clearly and systematically. So tell us, what kind of science is this anyway? What is it about?
Osteopathy emerged 150 years ago. It was created by an American doctor named Andrew Taylor Still, and it is an officially recognized medical specialty. Now it exists in Russia, but it originally came to us from America. So
So it's not some kind of alternative medicine?
it's considered, well, in different countries, it holds a different kind of status. For example, in America, in the US, it's also a higher medical education. There are medical universities there that grant MD degrees, Doctor of Medicine, and also universities that grant Doctor of Osteopathy degrees, or DO, and they hold the same status. So after graduating from a university and earning a DO degree, that is Doctor of Osteopathy, you can even go on to choose a specialization in surgery or any other medical field.
So you study the same number of years, 6 to 8 years?
Exactly, yes. So in Russia, they've made osteopathy equivalent to how it is in America. In Europe, it's a different story. In Europe, it's more like, say, a separate specialization like dentistry. And there are osteopathic colleges where you study for 5 years. So it's 5 years, about 4,000 hours of training, where they also study anatomy, physiology, biomechanics, and pathophysiology. And it is considered a medical specialty just with certain limited capabilities. That means they can't prescribe serious pharmacological products or perform surgeries. But working with different people with various issues, children, adults, that's absolutely allowed. In the same way, I, for example, am a doctor and I also have a medical specialization as an osteopathic physician. And I also obtained a license as an osteopathic doctor in Dubai. So in Dubai, it's also considered a medical specialty. That's why in many countries it's considered medicine. In some countries, osteopathy exists in kind of a gray area.
Please tell us, how did you come to the realization that the condition of our face, how we look, actually depends not on beauty injections, but on our posture, the state of our spine, and even our internal organs? So everything really is visible on the face, everything is clear.
Yes, because again, the body is a single whole. And to understand these processes, I spent 20 years because now I'm 35 years old. I actually started when I was 15. At 12, I decided that I would become a doctor. From that moment on, I began preparing to enter medical school. At 15, I won a prize at an international biology Olympiad and then went on to medical school. But at the same time, at 15, I completed my first courses in massage, in therapeutic massage, over the course of 3 months. And I started working with people, receive patients. That is while I was still in school. That's when I began using massage techniques, working on the back, working on the face, and also doing facial massage. And I quickly realized that massage specifically helps symptomatically. Because if you're only working with the surface tissues, it's good for maintaining health, beauty, and youth. But I was interested in understanding the deeper processes, specifically the biomechanics of aging. Why does this happen? Actually, when I went to medical school, while studying medicine, I was also exploring various wellness practices, as well as studying manual therapy, chiropractic, and began learning osteopathy. And I saw some incredible, almost magical results from my teachers and colleagues. It was amazing. And I wanted to be able to do the same. I started practicing and began achieving great health results. I can talk about that separately. But if we're talking specifically about face plasty and rejuvenation, when I worked holistically with the whole body, I noticed as a side effect that people looked younger. Their faces became more lifted, even though I didn't even touch their faces. That is, I can work with the pelvis, I can work, let's say, with the internal organs, and the face starts to lift. And after that, I simply started studying it in greater detail and studying it more. Studying anatomy, topographic anatomy, physiology in medical school, as well as therapy in different departments, and osteopathy in parallel. I compared these mechanisms and came to the understanding that the face begins to age over time because internal tension develops in various structures. Why this internal tension arises?
Well, do you mean muscular tension or something else?
Not just that. The thing is, yes, we all know about muscle tension, muscular clamps, We walk around.
The sternocleidomastoid, am I saying it right?
Yes, yes.
When a muscle is tense, it pulls down this whole muscular structure and jowls appear. I'm just explaining it simply right now. You know, that's a real thing, right? Or are you talking about different kinds of tension?
That's true. I mean, if we look at the face, we can see many different points of tension.
He's looking at my face like that right now. It makes me want to, I just feel like I need to prop something up, you know?
No, your face is beautiful. Everything is all right.
Thank you, indeed.
Yes. The sternocleidomastoid muscle, the platysma, over time, they become stiffer and pull the face downward. But these muscles don't work in isolation. Here is the truth. From our heel all the way to the top of our head, all the muscles work as a unified system. There are muscle chains, and that needs to be taken into account. In addition to muscles, there's also connective tissue, fascia. That is, just so people understand, fascia and connective tissue. If you cut meat, right, you see those white membranes, some strands. That's exactly what connective tissue is. And connective tissue serves as a sheath for everything, for literally each muscle fiber, for nerves, for every organ, for the brain. Everything in our body is wrapped in a specific covering. And this connective tissue, if you've ever seen mold, it kind of grows through things, right? Like if you have a jar of jam, the mold grows out from that jam, right? Saying about connective tissue is the same way. So literally, even if we remove the bones, what holds the shape of the internal organs? It's the connective tissue in the end. And now moving on next to facial sculpting and rejuvenation. Why is this important? The thing is that the connective tissue itself also has the ability to contract. It contains cells called myofibroblasts, right? These are so-called undifferentiated muscle-like cells, precursors of muscle cells, but they have the ability to contract. Plus, through the system of this connective tissue, let me make it clear, this connective tissue system functions as a semiconductor. And if we look at Eastern medicine, like the meridians in Chinese medicine, yoga, or Buddhism, they describe numerous meridians through which energy flows. In fact, I found certain scientific confirmations of this, that it is precisely this electrical activity, these electrical impulses, let's say, that also travel through the connective tissue. In other words, connective tissue functions as a semiconductor, and even our beloved collagen conducts these electrical impulses and also has the ability to contract as well. That's why contrast procedures are so beneficial. That's why stretching, tensing the muscles is so effective, right? Stretching, because at that moment there is a release of excess tension. And the fascial system also retains collagen. It permeates these so-called glycosaminoglycans, proteoglycans, and all of this creates a kind of liquid gel, right, where fluid can accumulate. And that's why, specifically in areas where there is tension in the connective tissue, plus spasms in the blood vessels occur, and there is always swelling and tension. And why does this happen? It happens due to stress. Stress can be physical, emotional, or biochemical. But no matter what kind of stress it is, the body responds. That is, a signal is sent and the tissues contract. And this is what causes tension points. Now I'll move on to these tension points. What are tension points? A tension point is not some kind of purely muscular block in certain superficial areas. It's a spasm, but these tension points can be anywhere. They can be in the internal organs, inside the internal organs. They can be in the bones, because bones are essentially calcified connective tissue. That is, it also contains collagen. Plus, there are also inorganic substances like hydroxyapatite, I believe, and so on. And the bone itself can also, with age, change its structure because it can accumulate tension within itself as well. And as a result of these electrochemical processes, bioelectrical tension and nerves and blood vessels are also affected by this. If we also add the autonomic nervous system here, how it regulates everything through the sympathetic and parasympathetic nervous systems, after that we can see that stress, any kind of stress, leads to tension at any level and any depth. And therefore, when we talk about youth and beauty, it is directly connected not only to the condition of our muscular system, not only to the cardiovascular system, but also to our fascial system and connective tissue. That's why all these practices, I'm talking about both breathing and body-based practices, are aimed at releasing excessive tension. Because as we age, if we don't release this tension, the collagen fibers in the connective tissue begin to shorten. And if we look at a child, for example, and then at an elderly person, we can see that a person starts to compress like a spring. Their posture changes.
And their height too, right?
Yes, height decreases.
Bone density, right?
Yes, bone density. This, of course, is related to certain hormonal changes, right? Like osteoporosis, but not only that. All these factors also play a role even before that, and they simply accelerate all these processes. So, as I've observed in osteopathic and bodywork practice so far, the body ages from the inside out. That is, it starts with the internal structure at first. These are the internal membranes, fascial structures, the skull, the spine. Tension and deformation occur there, and as a result, the superficial tissues also begin to deform too. And it creates a kind of paradox where bones can actually shrink, you see? There's even a term for it. They dry out. Yes, bones shrink with age. That is due to tension, and later due to osteoporosis, they really do lose volume and density. Fascial tissue is capable of contraction, and muscle fibers are capable of contraction. But what happens to the superficial tissues? That is the subcutaneous fat layer, due to intense chronic tension inside, which is caused, among other things, by stress, regardless of its nature. The thing is that when swelling appears, fluid retention happens. What does swelling provoke? Including gravitational ptosis and as well as stretching of the facial skin. So, on the one hand, the facial skin starts to sag because the internal structures begin to contract. Secondly, due to chronic swelling, the skin starts to absorb moisture, you see? And even if, what happens to your hand if you keep it in water for a long time?
Wrinkled?
It starts to become wrinkled. So if there's an excess, that is constant negative impact from tension and swelling, leads to wrinkles appearing more quickly. The face starts to become deformed.
Oh, wow, that's super interesting. You know, I never associated it with that. When I go to my osteopath in Moscow, he can immediately tell what kind of week I've had, huh? He just touches the muscles and says, "Oh, been working a lot." And I say, "Constantly working a lot." So imagine he can tell whether I've been under a lot of psychological stress or if I've been physically overworking. He can literally read everything just by the condition of the muscles. It's amazing. Remember, we were just talking off camera about the podcast and how it would go. And you said, but let's not make the whole podcast about facial plastic. Look.
You can ask any questions you want.
No. I just want to, many of my viewers actually, this is the first interview on my channel with someone like you, a true specialist. So a lot of people might not know what this is. Let's just explain to the viewers what faceplasty actually is and whether it's different from what we usually see on Instagram, massages and so on. What is it exactly? Where did this term come from? And why? Of course, we don't have to talk about it for the entire podcast, but you really are the top. You're number one in this field. You're really doing an amazing job. Right now, while we're talking, I want you to definitely show us your before and after pictures so people can see what it looked like before and what it can look like after, okay? So what is it?
How did faceplasty therapy actually appeared? Let me tell. So until I was 29, I was trying to combine the traditional surgical path with alternative approaches, including osteopathy. When I attended surgeries, I would observe and see the anatomy, what happens to the tissues during an operation, and along with my osteopathic experience, I simply integrated all this knowledge. I've eventually come to a conclusion that problems primarily arise due to excessive tension. The thing is that many people think that facial muscles need to be trained, That is, again, there are a lot of exercises for face building, for pumping up the face, that you need to train these muscles. But from my own experience, I found that in 95% of cases, yes, there are tonic muscles. And in some situations, especially if there was facial nerve neuritis and so on, training is necessary. But in most cases, the face is just simply overstrained. Even though outwardly it may seem like the face is tired and sagging downward, but that's due to internal tension within the structures. And faceplasty, face meaning the face, and plasty meaning reshaping. I actually wanted to create a method that could reshape the face in a way similar to plastic surgery. And I called this method first and foremost because when I worked with the skull and the face, I saw that the symmetry could be corrected indeed. That is, if we look, faces are often asymmetrical.
Well, that's normal.
It is normal. A slight asymmetry, if it's not, let's say, if it's not visible in photos or on camera, that's perfectly normal. But in my experience, I had many patients come to me with quite pronounced asymmetry, where in photos the face is noticeably distorted like this. It doesn't look good. And it's caused by various factors. It can even be due to prenatal injuries, birth traumas, and later acquired conditions. With the face and skull, I've seen that these asymmetries can go away. In other words, harmonization takes place because if we look at the skull, the bones are shown in different colors. So the skull consists of 22 bones, plus the hyoid bone makes 23.
I'm having a flashback. Anatomy lessons.
Yes. Exactly. Look at how many sutures there are.
Sutures, you mean?
Those are the joints between the bones, such as...
Please show it right up close to the camera so the viewer can see.
There you can see the different bones and there are joints between them. So for example, when we look at a newborn, during childbirth, the skull bones actually overlap each other. The skull can literally compress significantly. The bones just slide over one another, making it very mobile. Because of this, babies have fontanelles. As they grow, the bones begin to ossify, but not completely. And considering that bone it's not made of iron, it also contains organic material, there's a lot of fluid in it, so it's pliable. And under the influence of fascial tension, muscle tension, and also internal conflicts, especially if there were skull traumas sustained during birth or fetal development. What's more, if there was brain damage, such as hypoxia or cerebral ischemia, this always leads to the membranes of the brain starting to spasm and contract. And the bones also follow these membranes, which leads to a distortion. And depending on which part of the brain and skull the tension is concentrated in, this entire configuration can become misaligned, you see. And in fact, if we look at books, even American books on osteopathy, they describe these principles, the biomechanics of bone movement and pathological patterns. They explain what exactly happens when a particular bone shifts and how that leads to a specific type of asymmetry. For example, what kind of asymmetry might occur. The right side or the left side of the face looks flattened, as if it's reduced in size. That is, the volume of the cheekbone and the lower jaw is reduced, the eye is more closed, the ear is more pressed in. And on the other side, we see that the ear sticks out more. And also more pronounced lower jaw, the eye is more open. So it creates this kind of asymmetry. And in fact, it's simply a matter of biomechanics that I described. And it can be worked with. There's also asymmetry where the face takes on a banana shape, like a crescent moon, you know. That too is a different type of dysfunction, a biomechanical disorder. There are more serious injuries as well. When due to a subluxation in the sphenobacillar synchondrosis, face can change its shape quite dramatically. For example, when the forehead is slanted like this, you see elongated, or when the head is egg-shaped, and so on. All of this is related to bone displacement because in principle, we are all born in the same image and likeness from the same template, right? But due to certain external forces acting on our body, distortions occur. Distortions of our posture, of our skull. And it was precisely by observing this that I developed the faceplasty method, the technique that would work on correcting asymmetry. Then after a while, I noticed that the skull also changes with age. That is, if we look at children, they usually have more elongated faces. In other words, the shape of the face is more open, and with age, the skull becomes rounder and more compressed. At the same time, the cheekbones start to sink inward, right? That is, the contour of the lower jaw also recedes, right? And I realized that these processes can also be influenced if we also add work with the social system. Posture correction, and by the way, the influence of internal organs also plays a role. I can give an example. Even a double chin, for instance, can appear even if you have issues with the ovary, with the pelvis. Because even, I don't know, in medical university, right, at the institute, when we went to the morgue, when they remove the organs, how do they remove them? They go through the tongue, right? Everything is lifted up. If you look closely, all the structures starting from the tongue and so on, are all interconnected, you see? That is, through the system of fasciae and ligaments. And so our tongue, our chin, they are dependent on all these processes, that is, on the intestines, on the condition of the pelvis. Of course, there can also be tension here. Even the fear of self-expression and internal tension can also have an effect, can create tension, and from that, issues can also arise.
Well, like a misaligned bite, stuff like that.
A misaligned bite is a whole other topic. Honestly, I could talk about this for a long time. So, a misaligned bite is actually a big separate topic because depending on the position of the upper and lower jaws, the bite can develop differently, and the shape of the face will also vary. So, for some people, the upper jaw is pushed forward, and actually, the upper jaw is often referred to as the bone of beauty. The more forward and the wider it is, the more attractive the appearance it creates if the upper jaw moves forward. The thing is, it can also drop downward. If it drops down and becomes smaller, then the chin recedes as well.
That's unattractive, right?
And when you have a small chin, double chin appears, and as a result, the face becomes less attractive. There's a technique called mewing. There's a well-known orthodontist, Matthew Mew, who created this methodic. His father also worked on these issues, and he practices orthodontic treatment in the US. And at the same time, he is talking a lot about how the position of the upper and lower jaw affects aesthetics of the face and also affects the bite. And that's really the case. And I can confirm that from the perspective of osteopathy. Moreover, when using face plasty techniques that work with the skull, because it has one main technique, which is the position of the tongue. So you need to keep your tongue on the upper palate at all times. And this acts like a piston. It kind of gives a push of pressure to the upper jaw so that it moves upward and forward. And this essentially lifts it and makes the contour of the lower jaw more defined. With osteopathic work and face plasty techniques, this effect can be enhanced even further because you can work through all these sutures.
Alice, can you imagine I get comments like this very often, especially lately? Natalya, you who you were 5 or 6 years ago and now are two different people. Did you get a face transplant? Admit it. What kind of plastic surgery did you have? And I say, guys, I just wore braces for 5 years and worked a lot on my bite. My face really did change. Of course, we didn't just stop at braces, right? But people just don't believe that working on your bite can change your face so much. Well, again, by the way, I'm actually not entirely in favor of braces because after those 5 years, I still had to fix my bite. That's a whole separate story. But everything you're talking about is, of course, absolutely amazing. And this is, I've lived with this my whole life. My dad is an osteopath and manual therapist, so I know that you can work on your heel and your headache will go away. I saw all of this throughout my childhood. You don't necessarily have to go to an expensive specialist. You can at least start working on yourself. I mean, self-work, these simple exercises that Alice shows on his social media and in his platform. And I watched a bunch of your videos while preparing for this interview. And honestly, everything there is pretty simple. I mean, of course, you just need to make time for it.
Exactly, that's the point. You're not going to visit an osteopath every day. But in reality, you need to learn to work with your body every day on your own because, well, I don't know, it will be 100 times more effective. You should go to doctors, including osteopaths, in order to spot some kind of blind spot, something you can't fix on your own. Because in reality, there are some situations when the body gets so out of balance that it's hard to get out of it. And that's exactly when a specialist can help. But for daily work, you need to do it yourself.
So, about the face, right? Just so everyone understands what we're talking about, this is more of a medical matter. It's not that face building or face fitness, which you actually can see so much of on social media nowadays. What Alice is really talking about is osteopathy. It's a kind of medical
Osteofacial.
osteopathy for the face. These are different things, so it's a little different.
It's deeper, and just to finish my thought, besides working on symmetry and everything else, face plasty addresses these cause and effect relationships of tension. For example, why does the platysma even tense up? Or why does the sternocleidomastoid muscle? Because if we also include work with the diaphragm, some work with the internal organs, with the pelvis, and even psychosomatics, it can provide such a release that everything starts to tighten up. Because it's not enough. You can relax the platysma here, but tomorrow it will be tense again.
Well, look, let's mention the most common problems. Plastic surgeries, cosmetic procedures, what are they for? Drooping eyelids, right? And of course, wrinkles. A situation where with age the fat layer here becomes thinner, this part sinks in, jowls appear, and this so-called Jolie angle, as they call it now, is not as defined. The second one is a double chin. All of this, as I understand, is a consequence of stress, muscle tension, and so on. But if we go back to the root causes, to the original reason, what is the real cause? For example, incorrect sitting, incorrect lying down, improper physical activity. That's the cause of all this. Why do we start aging? Not when it's physiologically inevitable, that's clear. But from the very beginning, tell us.
There isn't a simple answer here because there are many different factors, a whole complex. That's why you need to start thinking about this from childhood. So there's genetics, which has an influence, but I would say, in my opinion, it accounts for about 30% at most. 70% is still our lifestyle.
Epigenetics.
Yes, epigenetics, and again, the epigenetics of our parents who instill certain patterns in us. Because we can see, for example, that if the father has a slouched posture, the child also develops a slouched posture. Even a funnel shaped chest, if the father has it, then the child may have it too. So there are both genetic and epigenetic factors. And first and foremost, in general, to put it simply, you need to pay attention to your posture primarily. That is posture, and in general, you need to learn to always reach upward with the crown of your head. It's as if you have the sensation of being suspended. So it's like
I'm sitting, and you're sitting the same way.
I'm trying. It happens, but I do try. So the first thing is to watch your posture, to constantly stretch upward, because even just the intention of reaching up with the crown of your head helps relax the muscles at the back of your neck, and you really do lengthen your spine. So that's the first thing. And if we don't pay attention to this, what happens? So let's say when we sit like this, certain muscles become tense and the force lines that run through the spine and connective tissue get bent. At these points of bending, excessive tension builds up, and like a snowball effect, if we keep reinforcing this habit, it will just keep growing and growing, you see? And this will lead to the tissues in that area compressing and becoming denser. That's why we can often see that people can have a short neck, or the back of the neck is twice as short as the front. There are many processes that influence this. Well, to put it briefly, first, watch your posture and, of course, your lifestyle. Obviously, everything has an impact, from sleep to any deficiencies you might have as well. That also plays a role. Plus, of course, stress itself has an effect. Psychosomatics have a very strong influence.
My dad told me my whole life that you not only have to sit properly and, well, hang on. My dad told me you shouldn't sit with one leg over the other, that you have to sit properly. Sit properly, but you also have to sleep properly. With a specific pillow, and get out of bed the right way, not the way we usually do, like this, right? But rather you should turn onto your side, get up from that position, and so on. So I remember all of this very well. And when I was little, I didn't pay any attention to it. But now I realize that it's true. I started sleeping, it was really uncomfortable for me at first, on an orthopedic pillow. I noticed that in the morning my neck and head almost never hurt anymore. As soon as I sleep somewhere in a hotel, not on my own pillow, I wake up feeling like I spent the night unloading freight cars. My neck hurts.
That's all correct. I completely agree with you. Honestly, I only truly realized how important it is to establish biorhythms when I just turned 35. Because, well, the body is like a factory. There are a lot of different processes going on there. Well, for example, it's like a production line. It produces certain materials, I don't know, something like that. And if you give it a task and then suddenly change the plans while it's already produced something and done some work, it doesn't understand. It experiences stress, shock. So, I mean, you need to train your body to follow its biorhythms. Sleep is definitely very important. You need to get enough sleep, like 8 hours a day, 7 to 8 hours. And there's a trap here as well. I can speak from my own experience. Sometimes I might sleep 5 or 6 hours and it feels like I'm full of energy. But when I started paying more attention to my biorhythms, including using things like bracelets and so on, I noticed that even if you don't fall asleep, you might still feel energetic, but your body is using up more resources. It mobilizes itself. and this still increases your stress levels. That's why I came to understand that sleep, yes, you need to get enough sleep, and I try to monitor that as much as possible. And then there's stress, oxidative stress as well, right? Oxidative toxic stress from various substances and also smoking, alcohol. Well, I won't even talk about those simple things. That's self evident. This destroys cells. That is, it creates chronic inflammation, swelling, depletes the immune system, and so on and so forth. And all of this can lead to impaired regeneration or even DNA damage. So then,
You just mentioned a puffy face. Tell me, please, can you tell by looking at someone's face, for example, whether they abuse alcohol or not? That's swelling too. First dehydration, then swelling.
of course, yes. In fact, moreover, when a patient comes into my office, you can even tell sometimes just by the smell.
By body smell?
Just by the smell, even. Often these people have a tense liver, a swollen liver. In other words, fatty hepatosis, and that's it. So right away, the liver.
So you can tell by looking at a person whether they drink a lot of coffee or a lot of alcohol. Is it visible on the face, in the quality of the skin?
Stress is very noticeable. Alcohol is also very noticeable. For example, coffee. Well, I also noticed that if I don't drink coffee, I used to have a habit, even an addiction, of having a cup of coffee a day, you know. Now, I try not to drink it at all. So I do see that there is a certain fluid retention as well. For youthfulness, it's still better to cut out coffee. There's a very important point about psychosomatics. I want to say that people gradually accumulate a huge amount of information within themselves over the course of their entire lifetime. First of all, emotional aspect. And all of this gets recorded in the body as tension, you see. So in fact, I came to the understanding that all the tension in the body is a consequence of stress, right? Or to put it in more esoteric terms, the accumulation of negative karma, you know. Basically, these are certain pathological neural connections that form and they are remembered by the body, sealed into the body and remain there for good. And if you don't get rid of it, what happens? These tensions create excessive bombardment of the brain with impulses, and this can lead to anxiety. So there's a mechanism where stress appears in the mind and then gets transferred to the body. But if tension is stuck in the body, that will also create anxiety as well.
Somatopsychics?
Yes, it will increase stress. And considering that as people get older, they accumulate a lot of things: unresolved emotions, grudges, fear, not forgiving someone, these tend to build up and create intense tension, which will have a negative impact on health. In addition to this, if a person, let's say, rejects spiritual and moral principles, I also see that this certainly has an effect. That is, people who violate certain spiritual and moral principles are also affected by this. Even their face looks different. A person with good intentions has a more relaxed and beautiful face, even if their face was originally by their own,
Not good?
yes, not good. It glows, it's beautiful.
I agree.
And the opposite is true. So certain spiritual and moral things, they have an effect, let's put it this way, in esoteric terms, on a person's energy, right? And this is also connected to certain, well, if we look at it from the perspective of neurophysiology, it's related to specific neuroplasticity, to certain patterns that are formed in the brain and in the body. This is the foundation. That's what needs to be worked on. Next. Of course, you need to put physical stress on the body. That is, the body, meaning the blood, needs to circulate, because the problem of aging, first and foremost, arises. And the main thing, I also listen to well-known biologists, biohackers, including American ones. They say that most deaths are caused by a sedentary lifestyle, and quick aging process happens as well. So a sedentary lifestyle, if we don't work on our cardiovascular system, it shortens our lifespan. The same goes for not getting enough sleep. That also shortens lifespan. This has basically been proven. So in general, physical activity is absolutely necessary. So, and in addition, all this is what I teach in my courses. On my educational platform for health and beauty is to learn to feel your own body and to be able to work holistically with the face and body as a whole united system. Learn more in description. Because when you develop the ability to feel your own body, you might come to the realization or have the revelation that, in fact, all this time, your body has been constantly screaming at you like, enough, stop, I can't go on like this anymore, listen to me, and so on. But because many people live in their heads and use their bodies only for moving around or for achieving their goals, they don't actually feel what's really going on. Oh, I like this. I also saw a study where they examined monks who meditate a lot. It's interesting. Their sensory cortex, that is the part of the brain responsible for gathering all the sensory information from the body, is highly developed. And in addition, the centers of awareness, which suppress certain parts of the brain responsible for the ego, for ego control, are also more developed. And this sense of self-importance, the I, is connected to control and fear. So if we become too absorbed in ourselves, being too egoistic, it becomes a constant source of stress. In general, a lot of things are happening, and when working, you need to feel your body. This is something you develop over time. And when you can feel it, when you can untangle these tensions, through meditative focus, self-observation, you can actually reprogram your neural connections.
Look, so tell me, our body is basically one continuous system, muscular, skeletal, and of course, continuous sphincters.
Yes,
And then again, I observe my patients. Out of 100 patients, 95 will have bends or kinks in their gallbladder.
yes,
And 90% of patients will have cysts or nodules that suddenly appear in the thyroid gland. This is also all, well, how is it that in just 6 months a person suddenly develops large nodules or cysts in the breast? Or again, now this whole issue with the gallbladder, even though their hormones and other medical, biological, and biochemical indicators are normal, how is that? I very rarely see healthy gallbladders, very rarely.
yes.
How would you comment on that?
How do I understand it? First of all, you need to work on all areas, the body, the psyche, and biochemistry as well. And if we consider why sphincter spasms occur, then again, we need to turn to neurophysiology to understand what controls the sphincters. This is controlled by the autonomic nervous system. In the nervous system, there is a part that is responsible for activation, which becomes tense during stress. When something happens and you are highly aroused, this triggers the mechanism of sphincter spasm. And the same goes for the sphincter of Oddi, the sphincter of the gallbladder, and essentially the pancreas. They all go into spasm. The sphincters of the stomach, the pylorus, in other words, there are many different sphincters. They all go into spasm. And during stress, the entire digestive system's function is suppressed because the digestive system works most actively when the body is at rest or asleep. But if a person experiences some serious problems, I mean, some intense stress, this spasm can persist for a long time. And this stress can turn into chronic stress if the situation is not resolved. So, what happens then? That is, during the first 3 months, the body mobilizes its resources, adrenaline and cortisol are released, and overall mobilization increases. After 3 months, if the stress is not resolved, the exhaustion stage begins. And from 3 to 6 months, the exhaustion stage continues. And when the exhaustion stage sets in and the immune system starts to decline, then after about 6 months, pathological processes begin, inflammatory processes start, and all of this contributes to inflammatory reactions, autoimmune diseases, and even DNA damage due to inflammation and oxidative stress, which can even lead to cancer. That's the stress mechanism. This stress can arise for various reasons. That's the first point. Second, there are always must be some deficiencies that accompany. So what I mean, if there are any deficiencies in our body,
Yes.
this can actually intensify it. And the third point is that there is a certain specificity that is depending on our reactions, whether it's the result of some kind of physical aggression, like surgery or stress, in one system or another, a blockage or tension can form. Because during stress, the brain sends a signal to spasm certain sphincters and tissues, and circulation is disrupted there. Again, returning to the topic, for example, of the thyroid gland or others, as I see it in these areas or in the organ itself, a local spasm and impaired blood circulation also occur, along with a chronic inflammatory process. What else could there be? From what I've read, and even when I was studying gynecology, obstetrics and gynecology, in the etiology, the causes of many diseases, even women's diseases, it is written that one of the reasons is impaired blood flow, that is tissue hypoxia, right? Plus, there is also hormonal imbalance. And there's another interesting thing. When we take blood, we assess the overall hormonal background
Well, here and now.
here and now. But inside the tissues, the damaged tissues where there is inflammation, swelling, the hormonal background, at least according to the information I've read, can differ by as much as 100 times. That is, the concentration levels of hormones locally in the damaged or affected organ can be different compared to the overall bloodstream. And these hormonal mechanisms, an inadequate concentration of hormones, if we're talking about hormone-dependent conditions like fibroids, for example,
Endometriosis.
ovarian cysts, yes. So on the one hand, this is a disruption of blood flow, it's a spasm. As an osteopath, I often observe that many women have a lot of tension in the pelvis area, the uterus, the bends of the uterus, and tension in the ovaries. So there is spasm and impaired blood flow. This creates hypoxia. Hypoxia is a lack of oxygen. Because of the lack of oxygen, the mitochondria in the cells, which produce energy, start to function poorly. And when they start to function poorly, this increases the amount of waste products, metabolites, which trigger an inflammatory process. The inflammatory process after that sets off an inadequate response.
Well, you see, there's so much work you have to do on yourself. But patients go to the doctor, for example, with some problems that they have, and what does the doctor say? Contraceptives. I am by no means against classical evidence-based medicine, but in most cases, simply prescribing a pill is not enough, right?
Of course, because that's just symptom correction. I have great respect for all of medicine, and I believe that all of my work complements medicine, whether it's osteopathy or face plasty. Sometimes people text me saying that, I promote face plasty and that I'm against cosmetology or plastic surgery. No, I'm not against it. I have a balanced attitude toward everything, including surgery and therapy. I support a reasonable approach and understanding.
So there's something I wanted to ask you. I just can't leave without asking this question. Let's get back to the face for a moment. I want to ask a couple more questions.
All right.
So Botox, fillers, various beauty injections, plastic surgery. Cosmetologists and plastic surgeons are categorically against any non-surgical methods of rejuvenation. Why is that? Is there really some kind of conflict between you? And what is your attitude toward everything I just mentioned, huh?
I understand the conflict because a surgeon has a scalpel in his hands and he will naturally rely on this method because it's the only tool he actually uses. For example, cosmetologist, on the other hand, relies on a syringe. And surgeons, well, they use their hands. Most people teaching face massage or maybe face fitness aren't doctors and lack access to cosmetic or surgical methods. So that's all they actually promote and can rely only on that. At the same time, their understanding is also limited. That is, when you lack information, when you haven't been on the other side, it also creates a certain illusion that you can solve all issues with exercises. No, that's not the case. So I believe that my methodic face plasty, just like osteopathy and physical culture, are first and foremost, in essence, fundamentally preventive methods. And secondly, these methods really can rejuvenate and heal. That's also possible. But there are truly advanced cases where exercises simply can't help. And that's why, since I also studied and took courses on how to do facial contouring, how to inject hyaluronic acid, Botox, but that was a long time ago, about 10 years back, I honestly didn't like this methodic, so I don't do it. No, I don't do Botox for myself.
You just have a forehead without a single wrinkle. I don't get Botox injections either.
I don't inject anything at all.
I've just learned how to turn off that part. People tell me, you're full of Botox. I say, well, okay, I'll take that as a compliment.
So,
You also look like you're full of Botox.
completely not actually. I mean, I know that in theory I could use these methodic now and make money from it too, but it's just not something I feel close to. And even about plastic surgery, even though I have a diploma, after studying medicine for 12 years, I don't really focus on that.
Let's be honest. Plastic surgery really does change people's lives.
Yes.
If you have some kind of psychological trauma about your appearance, for example, or rejection or whatever you want to call it, well, plastic surgery, it's a method, when you really want to change something specific. For example, your breasts aren't going to grow to a size 5 no matter how
Yeah.
much you rub every part of your body, even your neck.
Even 100.
It's impossible. That's the first thing. Like after childbirth, stitching up diastasis and so on. Also a story. I don't know. There are just so many cases like that.
It depends on the size of the diastasis. So in certain cases, if it's not too advanced, it can be corrected. But I mean, I'm fine with it.
Plastic surgery is okay. I really like skilled plastic surgeons. Yes, I have a great attitude toward them. I'm more interested in preventive methods, Botox, fillers, hyaluronic acid injections in the face. What do you think about that? What does Botox do to our muscles?
Look, Botox is essentially a neurotoxin, botulinum toxin, which has a paralyzing effect on muscles. In other words, it blocks nerve transmission and the muscle stops working. It simply can't contract. Botox has been used for a long time, and it was originally used for medical purposes. For example, in children with torticollis or various other problems, right? And later it started being used in aesthetics. Even among my acquaintances, I know many women who often use Botox, so I have a neutral attitude toward it as well. But there might be certain risks, and it's important to understand that. When I was looking for studies, which I talked about on my YouTube channel, so I found a 10-year study. So over 10 years, 63 publications on complications were analyzed. And overall, it's important to understand that after Botox, for most people, everything is fine, but up to 25% of people may experience headaches or migraines. 17 to 18% may develop various allergic reactions. And in 9% of cases, eye problems may occur, even vision problems.
Asymmetry, distortions.
Yes, even just vision problems. That is, various neurological disorders can also occur. One of my acquaintances texted me on Instagram that her sister, who got Botox injections in America, ended up with her whole body paralyzed, her entire body. She couldn't do anything for half a year at all. So
That's one case in a million.
that's one case in a million, yes. So when they started contacting the company, yes, they were told that such reactions can also happen.
Alice, look, well, okay, we understand that Botox isn't perfect, all right. But there are different types of faces. There are people who at 25 already have deep creases. I see this a lot in my practice. Now, I know what you're about to say, that it's something to do with the skull or the neck and so on. But still, a woman might have a deep crease or deep wrinkles. But in the end, if you think about it logically, Botox is mostly used as a preventive measure, right? Or still, okay, let's say someone has a tendency toward thin skin, like parchment. There really is such skin prone to wrinkles, the fine wrinkle type of aging, right? What should women with this kind of skin do?
I think it's possible to manage without Botox, but you have to realize that it takes effort and you need to work at it. That means you need to do a lot of things, both for your body and your face. And you need to be aware of all these tensions. And that's what I teach on my courses. At the same time, if you want to get a quick effect right here and now, and you don't want to work on improving your body and face, then you can go and get Botox injections. But that's entirely at your own risk. You simply make the decision and do it. Speaking of Botox, well, to be completely honest, I'm actually personally okay with it, especially if it's injected, let's say, between the eyebrows, for example, in that specific area. That is in small doses. But when it's injected into the neck,
The armpits,
yes, and all that, I have a very negative attitude toward that because I've seen and heard about cases where, for example, Botox was injected into the neck muscles and then the person couldn't, just lying on their back, unable to lift their head, or develop torticollis, or their shoulder blade dropped, or something else happened.
but as I understand it, they inject it into the neck to relax those areas.
That's something I don't recommend doing. I mean, there really are more natural, eco-friendly methods. So the thing is, again, I'm not persisting that you have to do only faceplasty. I'm just in favor of a reasonable approach. I believe that first and foremost, you should do everything as naturally as possible because that will give you health above all, and it will give you a long-lasting, prolonged effect. Because with Botox, you have to keep getting injections all the time. But you can practice faceplasty and inject Botox into certain areas at the same time. Yes, it's an extra risk, the risk that these are still toxins. How it will affect the body?
Eyebrows may droop.
Yes. And in 2% of cases, you can get eyelid ptosis or eyebrow ptosis up to 4%.
I've seen cases like that.
So basically, every 25th girl who gets Botox injections could end up with a drooping eyelid or eyebrow.
Tell me, in your opinion, what ages our face the most? Sugar, too much screen time, all that stuff. We're always sitting like this. Sometimes I record myself from the side. I have my own ways of working with my body. It's terrible. I mean, we really do sit like this. And then we wonder where all these issues come from and why everything starts to sag. I really try not to do it, but still. So, sugar, stress, gadgets, right? What else?
Yes, I'd say that of course sugar, alcohol, all of that, it will age you. If we're talking about the body, about body biomechanics, then what ages the face the most, in my opinion, is when the neck shortens.
When does that happen? When do we do that?
If we constantly sit incorrectly, if we're always on our gadgets and keep tucking our necks in.
Like this, right?
Yes. There's this thing. Yes, exactly. Computer neck and so on. So, first and foremost, yes, we're ruining it ourselves because of a sedentary lifestyle. Because a sedentary lifestyle creates a bend in the spine when sitting, and the load on the spine increases, I think, by 4 times.
We record podcasts standing up.
Yes, that's why we need to move more. Plus, it's important to mention here that the neck shortens not only because we don't watch our posture. It can also be a result of issues with our internal organs, the heart, lungs, or digestive system. You should check if everything is okay with you in general, your chest, your abdomen, your pelvic area.
By hump, do you mean the so-called dowager's hump? Isn't that just a buildup of fatty tissue?
That's just the mechanism. So why does it form exactly there? Because those are the upper thoracic vertebrae, right here, where the neck ends. These are the upper thoracic vertebrae. Ligaments of the pericardium are attached to the thoracic vertebrae there. So, the entire mediastinum is suspended by ligaments that are attached to the first, second, and third cervical and thoracic vertebrae. It pulls. When it pulls, it turns out that right there in the mediastinum, where the heart is, the aorta, and other various structures, it all gets pulled. Plus the diaphragm, which, if it's under stress, goes into spasm.
It's a huge muscle.
Yes, and the whole mediastinum gets pulled downward. So a bend appears. We try to straighten up, and because of the muscles that straighten the spine, those muscles get overstrained. And here, in the area of these vertebrae, swelling develops, because wherever there is tension, swelling appears. And swelling, inflammation, and even hypertrophy of the fat tissue in this tense area occur. And this kind of swelling, plus the neck itself starts to slide downward.
It doesn't look good.
Yeah, it doesn't look good. And what does this lead to? So even if I sit down, for example, if I put my neck like this,
I do that a lot.
well, everything starts to sag right away. So
Terrible.
that's the story. If I came and sat on the podcast like this,
But when we don't pay attention to ourselves, we all sit like that pretty often.
if you straighten up right away, you can see it's completely different. And this leads to tension, which creates stress in the skull. I'm not even talking about skull injuries right now. This creates tension in the skull. And all the key vessels run through here. Lymphatic vessels, venous outflow from the skull passes through here. When the neck shortens, all these muscles, especially the occipital ones, are in a state of hypertension here, in this area and at the base of the skull. All of this disrupts the outflow, which leads to swelling. I can even say, moreover, that when I go to the gym and do strength exercises, especially if they involve working the trapezius muscles, that is, the shoulders, because of the contraction of the trapezius muscles, I wake up the next day with significant swelling on my face. So, it's the tension. In other words, if you work out your neck and shoulders, the swelling increases. This shows that muscle spasms directly affect swelling. And if the spasm is chronic,
That's a very important point. Swelling and puffiness, especially in the morning, is a huge problem for women. The entire marketing around patches and masks is built on this. But in reality, there's a kind of swelling that no mask, no matter what, can help with at all. What is that? Is it also, again, the tension in these muscles? like you just explained.
Swelling. If we're talking swelling, know what kind. It can be.
Not heart or kidney.
If everything is okay, if the body isn't swelling, the body is fine, but the face.
You wake up, bags beneath your eyes.
If your body isn't swelling much, but your face is, it's a problem with the neck, especially the base of the skull, and specifically an issue with the venous and lymphatic drainage from the skull.
What should you do?
Work on your neck and work with your skull.
So just jumping around won't help.
Jumping will have an effect, but you also need to at least do some neck stretching, at the very least, right? At the very least, a lymphatic drainage facial massage. And even better, do faceplasty techniques that work not only with the surface tissues, but you can also work with the skull bones, breathe through all the tension, stretch it out, because that's exactly what opens up those valves, allowing the fluid to start draining.
Where can we let our viewers watch these practices for free on Instagram as well?
Yes. So,
Basically, you're one of the few specialists who so generously share free information.
first of all, I've actually noticed one thing. The more I give, the more insights I get, because you can't just hold on to information. So, the more I share, the more something interesting or new comes back to me right away. And that's considering I'm constantly learning. By the way, even though I share a lot, to be honest, that's only about 5 to 10% of the information that, for example, is available in my platform. And on top of that, when you get hands-on experience, when you have, let's say, a mentor or a coach that really reveals a lot of subtle nuances. That's why I share so much, and I'm really glad that people are getting involved. I constantly get thank you letters.
Oz, look, I'm really happy to hear that, because you're my colleague, and you're truly an amazing specialist. All our mutual friends go to you. I would personally come to you myself. If we lived in the same city, I probably wouldn't ever leave your place. I just think, well, I really see a huge value in what you do. I really love osteopathy, but not osteopathy like this kind. I've tried different methods, like that story where someone puts a finger on you and holds it there for 3 hours. Doesn't work for me. It doesn't.
Osteopathy.
Yeah. But look,
When you hold a finger, it works.
it works, but not for 3 hours. I'm a down-to-earth person. Here's the problem, here's the solution, and here's the result.
Yeah.
Look, so I record a lot of podcasts. And people listen to us like this, sitting there thinking. So you get up in the morning, meditate, and all that. One person says do it differently. Go drink some water. Another says to jump around. A third suggests face fitness, face gymnastics in the morning. A fourth says to work on yourself, and so on. Let's talk about the average, normal person. Not someone who meditates all day, but someone who works, has kids. Let's list the top most important things, not just for women, but for everyone, people of all ages. The top most important tasks in the morning to stay healthy, and the most effective methods we can use for our bodies in the morning, when we woke up. And it shouldn't take 15 hours to do all this.
Yeah, that's a real problem. Everyone is right in their own way.
Of course, it's just that we're normal, regular people. Please give us practical, applicable steps.
All right. First of all, I want to say that this is a process. And the more you work with your body, with your health in general, the more it draws you in. So you need to develop a love for it. You shouldn't do it by force or because you have to. That just doesn't work. Because now, I can spend an hour and a half or even 2 hours every day taking care of myself. Because I love it. Because I enjoy it. I understand and I feel these processes. But honestly, you just need to start. Even just 5 minutes a day dedicated to yourself is enough. So, what can you do in just 5 minutes a day? So, just
You wake up, walk over to the mirror, and see trolls staring back at you.
you can do some vibration, pat yourself gently. This is to get your blood flowing. So, vibration techniques, even just patting yourself, or there are Qigong techniques where you tap your body, or simply jump around for a minute, and that already stimulates you. You can do that in just 1 minute.
Yeah.
Then, in another minute, you can do a facial lymphatic drainage massage. Just use your hands to massage your face and
You can transport it in different ways. Sometimes you do it in a way that actually makes the swelling worse. Let's talk about tried and true techniques for massaging.
if we're talking about proven techniques, then whatever we do it with love, with care, and with gentleness. So first, you should close your eyes and make sure that your touch feels pleasant to you, that you're really touching yourself with love. That's very important because you can't treat your face like, I don't know, like some other part of your body, right?
Like dough.
Yeah, roughly, exactly. It shouldn't hurt at all. You don't need to overstretch the skin or anything like that. First, you need to get yourself in the right mindset for the work. That means you should have a therapeutic attitude. The simplest way to get into a therapeutic mindset is to focus your attention under your hands and gently, lovingly connect with your tissues. Really feel your face. Notice where you feel lightness, where you feel tension, where you can sense that tiredness. Just direct your attention there. And then, with your fingers, you like gently gliding over the swollen area. So first, start by working on your neck, meaning you can stimulate this area. So you need to work on the area of the sternocleidomastoid muscle and stimulate the spots just under the ears, where fluid drains from the skull and face. Then, starting from the center and moving outward, we simply make gentle stroking movements. At the same time, with your fingertips, you can feel that there's something like a gel or liquid under the skin. So, with your attention, you focus on this and start to slowly, very gradually, move this gel with your fingertips toward the ears. That's why all the lines we make are for lymphatic drainage, directed toward the ears. At the same time, you should be subtly sensing how the fluid starts to move. It's absolutely easy and safe to do this. It's essential to stretch and relax your neck. So,
What do you mean by stretch and relax?
the simplest thing. Again, if we're talking about 5 minutes, I'm mentioning the most basic things, simple, but very important. This is about working with the trapezius muscle. I said that the trapezius muscle, this one here, attaches to the shoulder blade and the back of the head. You need to stretch it. I have an exercise where we bring the arm back and stretch. So you really need to stretch this muscle well, which is why it should be done every day. Plus, it's very important to work on the diaphragm, because the way the diaphragm works affects our face and the function of our internal organs. You could do a whole separate podcast just about the diaphragm. Yeah, so through it, it's like a powerful piston. If we look at it, all the internal organs are attached to the diaphragm. The heart, lungs, liver, stomach, even the spleen is under the diaphragm. So all these organs, right? And when the diaphragm contracts, the dome moves downward. In athletes, this dome can move down as much as 12 to 14 centimeters. So can you imagine what kind of piston that is when they...
Pressure.
The pressure, so when a person, an athlete, is running, it's like this piston is pumping. Can you imagine what a powerful stimulation that is for the internal organs and for blood circulation, the stimulation of blood flow? Plus, in addition to the diaphragm, all those muscle chains and facial chains we talked about, right? They pass through the diaphragm. So if the muscle chains are like vertical lines running from the feet to the top of the head, then the diaphragms, including the thoraco-abdominal diaphragm, are like crossbeams, like the first floor, the second floor, horizontal layers. And when the diaphragm is working, it stimulates all the muscle lines as well. Plus breathing.
And also, there are openings, holes, hernias, passages.
That's why the diaphragm. Well, there are techniques for the diaphragm that I share in my YouTube channel, specifically osteopathic ones, for releasing tension from the diaphragm. Plus, breathing exercises as well. Even just taking a few breaths can be very stimulating. And if you have some extra time, do some stretching, right? Stretch your body. You can even do some stretching or yoga exercises. If you have more than 5 minutes, you can go further and start working with the facial muscles, at least. So, there's a powerful chewing muscle. And first of all, to see a good lifting effect, you need to work with the chewing muscles because they're large and many people have them overstrained. When these muscles tense up, the temporalis muscle, the masseter muscle, and also the pterygoid muscle inside, when these muscles are tense, the face literally contracts, it tightens up. The shape of the face changes, and because of this, the lower part becomes heavier. Swelling increases around the parotid gland because the masseter muscle is in spasm. And since the temporalis muscle is also in spasm, the face starts to droop downward. It's specifically the upper third of the face that begins to sag. That's why the masticatory muscles need to be stretched and worked on, because stress affects them. And then,
How to stretch them?
well, the first and simplest thing we can do. We can, for example, place our hands on our temples, press on the temples, and then open our mouth. So, when we open our mouth, we can feel the tendons start to stretch. And with your mouth open, you just start pulling upward, following the vector. So, we're doing a stretch. The same goes for the masseter muscles. We can fixate the masseter muscle at the bottom, right at the angle of the lower jaw, and strictly pull downward, not forward. Because if we pull forward, we can injure the temporomandibular joint. If we pull downward, everything is fine. So we hold it in place and stretch downward. So it's like we're reaching upward with the crown of our head. You can even do it while sitting, if I show you now.
Oh, go ahead.
Yeah. So we can place our hands, grab right at the angle of the lower jaw, and by stretching upward with the crown of the head, we create a stretching and lengthening movement, you see? These are powerful techniques. You need to practice stretching with them. Well, an even simpler thing you can do is just take the muscle, feel it, and simply knead it, rub it, find the sore spots. This gives a great effect. So, stretching the jaw muscles gives a really nice rejuvenating effect. Just check out my Instagram or YouTube. I go over this in detail there. Because right now I'm just quickly showing some key points. But later, it's important to work with the facial muscles. So if you have more time, you can work on it. If something bothers you, like the area between your eyebrows, that's the muscle that wrinkles your brow. You can relax it. Or you can relax the muscles that lift the upper lip, the muscles that lift the corners of the mouth. Because that's where the nasolabial fold forms, and the tension in these muscles actually causes the crease.
And we inject them.
Well, actually, the nasolabial fold, well, if the crease isn't deep. But specifically, if we're talking about hyaluronic acid, I'm mostly against it. So, probably, within the field of cosmetology, I'm most negative about threads and about hyaluronic acid. Everything else, well, laser cosmetology is okay. It's not too bad. But there's a fine line between heating the collagen and overdoing it, which can cause burns, and as a result, blood circulation can be disrupted. Well, that's still.
Ultraformer, right?
Yes. So you just need to be careful here. Anything above 60 degrees starts to break down and degrade.
Plastic surgeons really hate these procedures. If only you knew. All right, let's not talk about that.
So about the exercises. Next, if we're talking about even deeper exercises, that's when you start working with your skull, your posture, your internal organs, and
Wait, so is it actually possible to work with your skull on your own?
of course, primarily because, again, I've worked. I don't even know how many thousands of patients I've seen over this time. And I've noticed that those patients who actually follow my recommendations and do the exercises get much better results. Because here, the amount of time you spend on it really matters. And even if someone comes to me, for example, so I can do something to their face, if they don't do anything themselves, they'll get one kind of result. But if they also work on themselves, the result will be much better. And it's cumulative. The main thing is that you can keep building it up over and over again.
I've been doing facial massage for many, many years in a row. I don't do it myself, but I go often, really often, like several times a week for a facial massage. I can see how my face is changing, especially if the specialist is really good. I mean, I have 3 favorites in my hometown who do myofascial massage and buccal massage. I can honestly see, even just over the past few months, how my face is changing.
It works. It really works. Because when you get a massage, if the specialist is good, they can work the tissues quite deeply. And moreover, in our muscles and tissues, emotional stress accumulates, like facial expressions, right? So it's connected to psychosomatics.
Of course.
Fear, anger, irritation, all of that gets stored in the face. And that's why, if you work on your face, either using techniques on your own or by going to a specialist. It simply relieves the excess stress in the tissues. And of course, the tissues come back to life because there's more blood, oxygen, and that affects regeneration.
Listening to you right now, I'm thinking, that's it. I'm going to start doing this at home too. Can you imagine if you had doing it at home too? The effect is amazing.
Absolutely, no doubts. And if you do it, here's another really important point. Uh, don't just do it like regular fitness, do it as a meditative, I'd even say as a spiritual practice.
Of self-love.
Self love. Because if, in addition to your hands, you also add your attention to this practice, also with the right intention. Because what really is the heart? Why? Well, where are these emotions located? Where are they generated? First and foremost, in the area of the heart. If we look at the heart from a physics perspective, it's a powerful generator of electromagnetic radiation. It's 10,000 times more powerful than the head. And certain states like love, compassion, empathy, right? Humility, gratitude, they create such a powerful resonance that, for example, even physical tension in the body can dissolve. In fact, just adding daily practices of gratitude and love is helpful. This is very important because even with a simple practice like this, if you spend a few minutes in a state of gratitude, your body will feel much lighter since the tension is released. Because through resonance, through synchronization, after all, every cell forms this, and it has electrical activity, right? Electrical processes are happening everywhere in the body. And thanks to the heart, all these field structures are aligned and synchronization occurs. This is actually an important point. It's what I call spiritual, right? This also plays an important role in health and rejuvenation. That's exactly why different religions talk about this, as do various spiritual teachings. And it's something you need to keep in mind. So you have to do it with love, with a sensitive awareness of the tissue, so you can feel what's happening. Because what does this do? For example, we find a blockage, some kind of tension. If we bring our consciousness, our attention, our awareness, more precisely, plus our state, into that area, it starts to rewrite, to reprogram those tension patterns. In other words, we become aware of it, and it begins to dissolve more quickly. That's why it's so important to approach this practice in a meditative state. Probably for many people, meditation might not be very clear, even though it's popular now and maybe, I would even say, because it's become too popular.
Speculative.
It's a speculative topic. Speculative in the sense that some people think it's a religious thing, and also speculative because a lot of bloggers have started.
They do it without understanding.
Yeah, but in reality, what is meditation? Meditation is when we shift our focus from the thinking process, meaning from certain centers of our brain, to feeling. So there are even certain centers of the brain that are responsible for, that get activated during meditation. And so, during meditation, when we calm down, when we enter a state of silence and tranquility. In osteopathy, there's even a term for this: stillness, the point of rest, the point of silence. And I really like that, even in Christianity, there's the term humility. Humility not from the perspective of weakness, but from the perspective that you are accepting the world as it is. In other words, you sort of synchronize with the world, you calm down. And gratitude, love. Because right now we live in a world
Anxious.
anxious, especially with the amount of information, because now, thanks to gadgets, we develop attention deficit, or rather, attention exhaustion, and a fear of missing out. Because we always see that someone else has it better. This creates tension and constant stress in our bodies. There are certain ego centers that latch onto this, and they constantly.
They hammer you.
And this tension that we feel is connected to that. That's why meditation, when we shift our attention to certain centers and practice self-observation, helps. And it's precisely in meditation, by increasing our body's sensitivity and observing these patterns, that, thanks to the brain's neuroplasticity, reprogramming takes place. And all these emotional blocks in the face and body start to dissolve. And it really works. Moreover, I'll add, if the term meditation makes you uncomfortable, You can pray during this process. It's basically the same thing, pure intentions.
Off camera, you and I were just discussing different topics, and we talked about reflux disease. It's right. Reflux, esophagitis, GERD, hiatal hernia, and so on. Basically, all of these revolve around the same symptoms: belching, discomfort in the epigastric area, constant burning, and so on. There are a lot of different causes here. But you just mentioned some really interesting things about the diaphragm. How does that work? How do you deal with that? And we were just talking about our mutual acquaintance. You said that even serious diseases of the esophagus and stomach are connected. Connected to what?
To slouching and neck problems. I've even seen patients who had herniated discs in the thoracic spine. Although, in reality, that's actually pretty rare. Most spinal hernias are found in the neck and lower back. Well, first in the lower back, then in the neck. They're less common in the thoracic region. But specifically, when it comes to issues with the esophagus or stomach ulcers, I see a correlation. People with these problems often suffer from back pain in the thoracic area, and they also tend to slouch. Why does this happen? Because the esophagus is actually a muscular organ made of smooth muscle, a strong tube. So under stress, what does it do? It contracts. In other words, the esophagus simply shortens. Even when I experience stress, and there have been stressful moments when my acidity increases, I feel like I start to hunch over a bit, like I'm tensing up. Can you believe? I work on my esophagus, do exercises for it, and my shoulders immediately open up. So it's really like that. So it's this internal muscle. And another important point is the esophagus and the vagus nerve, right? There are two branches of the vagus nerve that run along the walls of the esophagus. And everything there is kind of wrapped up in plexuses and nerve fibers, right? That's why any stress or tension hits there first, of course.
I'm a doctor, and I work a lot with patients who come in and say, I have GERD, I have a peptic ulcer, I have gastritis, and I've been taking omeprazole and all sorts of medications, antibiotics endlessly for 5 years. I have Helicobacter. I always tell these patients that Helicobacter is real. It does exist. And indeed, anatomical, physiological, and pathophysiological damage is possible. But all these problems are already just consequences, and pills won't help here. Just taking a pill won't solve it. You need to dig deeper here. If you want to truly restore the function of your organs and in a classy way, right?
In a classy way, without going overboard. So I can't say that I'm totally against it.
And so that damage to these organs doesn't lead to damage to other organs and organ systems as well. What am I getting at? I'm saying that you're sharing incredibly interesting things like it would seem gastritis, reflux, a kink gallbladder, bile stasis, or even gallstones themselves, they always have a cause. And very often, where does this come from mostly? From the spine.
Not exactly from the spine. I wouldn't say that all problems come from the spine on the first place. From what I see, first and foremost, it comes from something as basic as stress. That is, a certain kind of excitement or agitation in the head, which gets transmitted to different systems, and this disrupts blood flow. So, if we look at it, of course, the spine has an influence, of course, because nerves and plexuses branch out from the spinal cord. Everything works together as a whole, right? That's why it's hard for me to say that just one thing affects everything overall. Even if we take the stomach as an example, I mean, of course, the easiest thing is to take a pill, and it gives you a sense of improvement. Although all of that is actually very harmful, because even if we lower the acidity, nothing good will come of it. We need to look deeper. If we look again at the root cause, what's happening is that the hydrochloric acid in the stomach starts to erode. Mucus. The mucous membrane, and it's not necessarily even related to acidity. First and foremost, it's connected to the fact that the rate of regeneration of the epithelium, the lining of the stomach's mucous membranes, is disrupted. So, if we're talking about the stomach itself, it's very well innervated by the trigeminal and vagus nerves. And under stress, we often feel a lump in the throat, right, or a strong tension in the solar plexus. That means all the blood vessels and everything in this area go into spasm. As a result, The stomach's mucous membrane just doesn't get normal blood flow. If blood flow, and therefore the ability to regenerate decreases while the aggressive environment becomes stronger, then the stomach starts to get eroded, you see? And here we also have Helicobacter, which, yes, it might make things worse. Although, again,
Everyone has Helicobacter,
right, that's it.
like herpes.
That's exactly what I'm saying. So, yes, the body's protective mechanisms just aren't working. So, blaming everything on Helicobacter or something else isn't right. That's why you need to restore things. Plus, the diaphragm also plays a role here. It also gets disrupted, meaning acidic contents get thrown back into the esophagus, and it all becomes a vicious cycle.
We were also just talking off camera about various women's health issues: polycystic ovary syndrome, multifollicular ovaries, different cysts, fibroids, and again, to varying degrees, endometriosis. So these are all organs of the pelvis.
Yes.
The pelvis, as I understand it, is a very complex structure, very important. And please tell us, from your point of view, why do diseases of the pelvic organs occur?
From the perspective of osteopathy, when I examine people, my patients, I see that in many cases, in the vast majority, the pelvis is under a lot of tension.
Why?
Why does this happen? First of all, a sedentary lifestyle under the influence of gravity. And so, where does all the fluid flow? Stagnation. That is in the legs, and the pelvis. So, a lack of activity causes stagnation in the legs and pelvis, which can even lead to joint problems and issues, yes, with veins and so on. That's the first point, the simplest and most obvious one. The second point is related to, if we look at it from an osteopathic perspective, to injuries. Any falls on the tailbone or sacrum, that's irritation again of the lumbosacral nerve plexus. And this can also cause spasms. And I actually, what?
Childbirth.
Childbirth. That can also be a very serious trauma. I'm not trying to discourage anyone from giving birth, not at all. You just need to prepare the pelvis. And I remember one patient who had a crack, not even a displacement, just a crack in her sacrum. And she had absolutely hellish periods, menstruation. All hurt a lot. Plus, I don't remember exactly, but there were some other gynecological issues as well. But the real starting point was the injury, because the nerves that innervate this whole area are located right in the sacrum, so it disrupts blood flow and causes severe pain. That's why injuries really do play a role. The next point, third, is psychosomatics as well. Which nerves are affected? The vagus nerve and also the sacral nerves. So the sacrum is where the autonomic nerves branch out, and during times of stress, their function is suppressed. As a result, the first thing that happens is spasm in the rectum and sigmoid colon, because it's specifically the rectum and sigmoid colon that are innervated from the sacrum, from this area.
Even hemorrhoids.
Hemorrhoids, well, hemorrhoids, the mechanism is a bit different, but this does have an effect. Plus, there are also issues with the liver because the venous outflow go through the liver. That's why, especially if there are liver problems, if the diaphragm isn't working properly, if the liver isn't functioning well, flow through the mesentery of the small intestine, this leads to venous blood stagnating in the rectum and sigmoid colon, which causes the venous cavities to expand, right?
So the next factor is stress, because stress causes spasms, spasms in the connective tissue, the fascia in the pelvic area, and in the blood vessels.
And considering that the blood vessels, if we look at the pelvic organs, like the female organs, the vessels run through the ligaments, that is.
And when these ligaments are tense, all of this together disrupts blood flow.
Plus, of course, there are also hormonal factors. In osteopathy, all hormonal changes are corrected, but indirectly through working with the head with what we call the craniosacral system, because osteopathic techniques can affect the skull, and through this, the movement of cerebrospinal fluid can be normalized, And considering that cerebrospinal fluid comes into contact with the structures of the brain, this leads to a release, relaxation, and as a result, greater harmonization can occur. So, there are many different mechanisms, and what can osteopathy bodywork techniques and practices actually help with? They can identify where there is a key block or tension, no matter where it is. Whether we see that there is a nerve spasm, or more precisely, nerve compression or a blood vessel spasm, or tension in the ligaments or tension in an organ, we can work with that right. Look, because an osteopath, of course, is not like an MRI or CT scan. He can't say with 100% certainty exactly what's going on inside. But thanks to their highly developed sensitivity in their hands and focused attention, built up over thousands and thousands of patients, an osteopath can determine exactly which structure is holding tension. And where there is tension, as I mentioned before, there is always swelling, there is always impaired blood flow, and there can even be inflammation because inflammation always involves tension as well. So, by working with the tissues, it's possible to restore balance to those tissues so that blood flow returns, and then the body itself begins to heal that area. In other words, it's not the osteopath who heals diseases with some kind of special energy. No, what we do is create the conditions so that the body can
Mobilize itself.
mobilize its resources, immune cells, so they can get there, so oxygen can get there, so all the nutrients can reach the area, and so all the waste products can be removed and everything starts to normalize.
So, I really love Eastern medicine. I've studied it a lot. In general, the holistic approach, and there's actually quite a lot of evidence and research on this in many studies, shows that, for example, working with the feet, the soles, the heel, or the ear can really do some incredible things. What do you think about that? You agree?
Very positively, it's really true. Because you can approach this from the perspective of Eastern medicine, like the Chinese meridians, but you can also explain it from the standpoint of the musculoskeletal and facial systems too, and the nerve receptors that are totally everywhere. So, if we look at the most sensitive parts of the body, where are they? So, even again, why am I bringing this up? Because it seems like modern, or rather traditional medicine and alternative medicine, as if they're disconnected and exist kind of separately from each other. Over there, there are some energies, meridians, and that's it. And here, there's another kind of medicine, anatomy, physiology. But in reality, I'm trying to connect this. It's actually explainable because in the brain, there's a part that processes sensory information, the receptors. And in the brain specifically, the areas for the face, the hands, and the feet, they have, especially the hands and the face, have the largest representation. I mean, overall, the legs are smaller.
Representation.
Representation in the form of, listen. So, a large part of the brain processes information from the hands and the face. That's why, of course, there are biologically active points, and well, I'll just say it as it is, all right? So, because of long term practice, I can feel how energy moves through my body. I can totally feel when this energy moves harmoniously and when it doesn't. But all of this can be explained by the state of my nervous system and the state of my facial system as well. Because, as I said, all these electrical impulses, they pass through the nerves and through the social system. If I tense up somewhere, I immediately feel a block and tension, a kind of dense, tense lump appears, and the energy doesn't flow through. But that's due to the bioelectrical activity that connects.
Because I've spent many years in this field.
I'm just saying, don't be alarmed if you hear the word energy, because the whole body produces a huge amount of energy, every cell, every organ.
Alice, my listeners know what energy is, and on my channel, there aren't people who don't believe in something just because it doesn't fit, into some kind of evidence-based framework. My audience here is a little different. All right, please tell me. Next question. Alice, so I've been watching your videos, and in them you talk about how, for example, osteopathy can help normalize nasal breathing, which is super important, and even get rid of snoring.
Yes.
Somehow, because most people think snoring can only be fixed with surgery, right? Or only with some serious medications. I really like that reel of yours.
So listen, it all depends on the degree first and foremost. And if we're talking about nasal breathing, then
But why breathe through your nose? You can breathe through your mouth, right?
that's a totally different topic. I mean, it's a really important topic. You need to breathe through your nose because it affects your bite and the development of your entire facial skeleton. So, people who breathe through their nose, their face, like the lower jaw moves forward. Well, actually, it moves back, it sinks in, the upper jaw drops down, and the face becomes less proportionally attractive. And in addition,
Mouth or nose breathers?
those who breathe through their mouth, yes. And of course, there are also problems with the bite and with posture, because people who breathe through their mouth will definitely have posture problems as well. So it's absolutely necessary to breathe through your nose.
Yesterday on the podcast, a young man, a biohacker, told me that there's this thing, a special tape you put over your mouth at night so that, can you imagine a biohacker so that you breathe through your nose? You tape your mouth shut for the night, you know this? And actually, you really have to get used to it. It's not an easy thing to do. I was really surprised.
Yeah, I know. When I first saw it, I was surprised too, and honestly, I even started to kind of hate on it a little. But maybe there's something to it, I don't know. I haven't tried it myself. I'll try it out and let you know. That's it. But if we go back to the nose, to nasal breathing, and look at the nasal cavity in general, you can see there's a lot of space between the bones. And this space is filled with mucous tissue. So even if an X-ray shows a deviated nasal septum, meaning the bone structure is crooked, that doesn't necessarily mean you can't breathe. Because first and foremost, it's related to swelling. Especially for people who have had nose injuries, this also creates tension, disrupts blood flow and circulation. This all leads to swelling and breathing problems. And if a person constantly uses vasoconstrictor nasal drops, that can also cause ongoing swelling and inflammation. And third, well, if there's some kind of chronic inflammatory infection, right? With osteopathic treatment, it's possible to relieve and eliminate the tension present in the mucous membranes and the bones of the facial skull, which will allow mucus and stagnant fluid to drain away. You know? The volume of these mucous membranes decreases, and nasal breathing improves. So it really does work.
What to do with snoring?
Well, if we're talking about snoring, it's primarily related to the palate, right? The soft palate, specifically the muscle of the soft palate. And, when they do surgery, there's a fat pad there that they remove and the snoring goes away. But from what I see again, snoring can occur. On one hand, an increase in fatty tissue can trigger this. So, for example, if a person is obese or kind of overweight, that can be a factor. But we can also see that even thin people can start snoring as they get older. I can even say about myself, when I worked in the hospital as a surgeon, I had very unhealthy lifestyle. For example, didn't sleep well, had night shifts, and so on.
You didn't look good.
I didn't look good. I was constantly puffy. And well, basically, I was living on stress and cortisol. And that's when I started snoring. I mean,
Because you didn't have extra weight, right?
I didn't have any extra weight back then. I was just swollen. I was 10, 11 years younger at the time. So it was because of the swelling, because of the tension, because of the swelling. So basically, certain things like tension in the palate muscles, tension in the skull, can cause swelling in the soft palate area. And the position of the tongue also plays a role. So swelling and tension can lead to snoring. And if you work on all those areas, all those muscles, the facial skull, then snoring can really go away as well. I have many cases where snoring went away, but I can't guarantee it in 100% of cases. It all depends on the severity. The fact you can influence this mechanism, that's true.
Everyone, let's go to Alessia's Instagram to check out the free techniques. Tell me, please, I also saw in one of your videos that if your hands and feet are always cold, that's not a good sign either.
First and foremost, this is related to changes in blood flow, right? Because when we're in a state of stress and heightened arousal, yes, women tend to be more predisposed to this. Maybe their sensitivity is higher. Again, women are usually more sensitive than men. Well, what I see is that this is again related to the stimulation of the nervous system, which causes certain blood vessels to dilate. So when a person is under stress, blood flow increases to the heart, lungs, and brain. Everything else, on the contrary, goes into spasm. And specifically, the peripheral capillaries right under the subcutaneous fat are the first to go into spasm. By the way, this explains why face increases during stress and why your hands and feet get cold. Because the small capillaries in the surface tissues constrict in response to stress. And the same thing happens in the face. When you relax your body, improve blood flow, and enhance the function of your nervous system, your hands and feet often become warm afterward. That's it. But of course, you should also keep in mind that there can be certain individual characteristics.
I also read from you that osteopathic practices can influence libido levels and even affect orgasm, right?
When it comes to topic of libido, orgasms, and even I would say erections, these are all mechanisms, these complex processes that are intricately connected to the body, to bodily functions and responses,
Blood flow?
blood flow and bodily tension. Because again, let me start maybe with, yeah, either with erection or with orgasm. What happens? I mean, there can be different reasons. Is it interesting to talk about this topic of erection here?
Of course. Yeah, definitely. You see, if with orgasm you can still somehow work things out, then from the male side, if there's an erection,
By the way, I've had patients come to me with that request as well.
which request?
Regarding impotence, erection issues, of course, it's a big topic. And here it's important to understand that there are, of course, vascular problems like atherosclerosis, all those age related things. But first and foremost, it's a functional issue, again connected to the brain and to the tension in the pelvic area. This leads to vascular spasms because an erection depends on blood flow in the first place. And this process only happens when you're calm and relaxed. And if there are any tensions in the sacrum, tailbone, the lumbosacral plexus area, lower back, inside the pelvis, or the pelvic diaphragm, all of that will, of course, affect both erection and orgasm. Because there's also the pudendal nerve, which branches out from the lumbosacral plexus, basically from the spine, from the sacrum. It goes further and innervates. In other words, it's responsible for the sensitivity and functioning of the sexual organs. If everything is tight in this area, in the sacrum and pelvis, the pelvic diaphragm, this creates pressure on these nerves and receptors. And what happens when there's pressure? Like when someone sits for a long time, they start to feel numbness afterward.
Those now.
It goes numb. So this numbing effect can also happen inside the tissues, which leads to a decrease in the sensitivity of the receptors. And that's why I see this correlation. In particular, I have women who have taken my women's health course during my training, and they write to me that after working with the pelvis, after using gentle techniques, working with the internal organs, working with this nerve in the sacrum, and even orgasms, it increases because swelling and tension actually cause a dulling of sensitivity. So this numbness,
Everyone should exercise, right?
well, yes, these are basic things, but in reality, it is important.
Not so long ago, you and I talked about Professor Bubnovsky. He always says, exercise cold showers, exercise contrast showers.
I would add to that. All of that goes without saying 100%, of course. What can osteopathy add? It can add a specific, precise kind of work where you can look inside yourself and understand exactly where your dominant tension or block is, the one that disrupts blood flow and nerve function. Basically, that's what osteopaths generally do. That is, thanks to their knowledge of anatomy, biomechanics, and physiology, plus their heightened sensitivity, they can scan and feel different structures in the body and identify where the key tensions specifically are. These tensions can be the reason for the development of certain diseases. If you remove these restrictions, the body, it's like a complete reset happens.
Ellis, I really want our viewers today to get a clear understanding of what this actually is. Because honestly, I'll tell you, for a lot of people, osteopathy seems like something from some kind of out there doctor. Not even a doctor, really, but just some eccentric person who works with energies or presses on certain points and so on. I want people to come away with the impression, with a clear understanding, that this is one of the most comprehensive approaches to health, just like what I do, what my colleagues do, doctors of preventive medicine. But here, it also involves working with the body. Why did I even dream of inviting you here? I wanted people to hear this, how working with the body, with fascia, can influence not only psychosomatics, but also how the body affects the mind. It works both ways. This is amazing knowledge. To me, this seems like the most comprehensive approach to health, the most holistic medicine. And regarding the pelvis, right? There are different exercises, like Kegel exercises for training the pelvic floor muscles. Now there are also devices like Imsella. You know about them, right? What do you think about that? Can these exercises help in some way, or could they actually do harm?
I'm just very cautious about mindless stimulation because
Not mindlessly. We're talking about it thoughtfully.
I won't make any claims right now. I haven't personally used those devices for pelvic stimulation. But there's one important nuance here. So the paradox is that what I usually diagnose is actually excessive tension, a state of stress in the tissues, specifically in the vascular and facial tissues, because of the tension and the fluid that accumulates, because of the tension in these tight, heavy tissues, and due to disrupted innervation, the muscles can also remain tense for quite a while. But over time, they can actually start to gradually stretch, and that's what leads to the sagging effect. And working on contracting the pelvic floor muscles is effective itself. But if we create excessive stimulation here, we can make the spasm even worse. That's why anything related to myostimulation, well, so listen, here you can cross that line where you end up creating even more tension in the pelvic area.
And Kegel exercises,
It's very important. Kegel exercises are very good, but I use my own special techniques there, which I believe are even better. Again, I'm not saying my techniques are better.
It's just that the effect I get comes from giving techniques for both relaxation and toning and all at the same time. So it's not just about training the muscles. The main thing is for people to feel and be aware of what's happening inside. So overall, Kegel exercises are good. You just need to add some extra techniques and definitely include not only toning techniques, but also deep relaxation of the pelvic floor through breathing practices and other myofascial techniques, all right. This will simply give a better result. And you need to work with the internal organs, work with the diaphragm, because all of that puts pressure on the pelvic floor and causes problems.
after talking with you, I feel like I want to go stretch and work out right now.
I also wanted, if I may, to add a comment here. You mentioned osteopathy, and it's true that there are different kinds of osteopaths. There are osteopaths who work mechanically. At the same time, there are osteopaths who, according to other people, according to patients, just lay their hands on you in energetic practices. To be honest, both of these are considered osteopathy. But there is official osteopathy, medical osteopathy. And medical osteopathy it has cut that part off.
I don't recognize it.
Well, it's not scientifically provable, so it doesn't exist as far as they're concerned. Because scientifically, there really are a lot of studies on how osteopathic techniques, these are specific manual techniques, like when you work with the spine, the abdomen, or the head, can relieve headaches, migraines, improve digestion, or eliminate back pain. So this is medicine. And there's not a single word here about any kind of energies. But just so everyone understands me, especially those who know both sides, there's also what's called traditional osteopathy, or you could say traditional osteopathy. I want to share, this is actually what the founder of osteopathy, Andrew Taylor, still promoted, and then his student Sutherland continued. But what they actually wanted in traditional osteopathy, the foundation of traditional osteopathy, is that it also involves working with life energy. If we look at various forms of Eastern medicine, for example, there's chi energy or prana energy. In osteopathy, in traditional way, this is referred to as fluid. And while the founders worked with the whole life energy, but later, when osteopathy started to become popular in America in the early 20th century, due to a lack of understanding from the medical community and science, all of that was totally cut out, and only biomechanics and manual therapy were left. So basically, osteopathy became just an extended course in manual therapy. Because manual therapy in the Soviet Union also appeared generally thanks to chiropractic and osteopathy, which were adopted from the West as well. And this really works. And this also works powerfully, because, as I said, a person is both a mechanical system, a biochemical system, and an energetic system. That's exactly why it happens that certain subtle techniques, like if the specialist knows what they're doing by placing their hands, they can do even more in a few minutes than another specialist who spends an hour cracking, massaging, or adjusting vertebrae. That's really how it is. I can say this based on my own 20 years of practice, starting with massage, that this is true. It's just, there's nothing esoteric about it.
There's no religious undertone here. It's simply that there are certain energetic things that happen as a result of specific harmonization. Because in the tissues, where there is tension, it's not just a muscle spasm that occurs, and not just a vascular spasm. There's also an accumulation of ions like potassium, calcium, and sodium, which creates a sensation of an electrical or energetic clamp, a block. Then this also leads to a powerful discharge and alignment. So basically, all of this exists. It's all osteopathy. But if we're talking about medical osteopathy, it doesn't recognize this. It kind of remains as a postgraduate course for those who are interested.
Advanced training. I want to ask you something important. I really love the gastrointestinal tract. It's always the first thing I talk about, care about, and when I work with patients, I often focus on normalizing the function of the GI tract. If I could work with my hands like my father does, I probably would have achieved even better results. But it didn't work out for me. I tried, but I just couldn't do that kind of work.
It's hard to juggle everything.
Yeah, that's true. Anyway, back to what I was saying. The intestine, to me, is an amazing organ. You must know, people say, and they're right, I didn't come up with this, that the gut is the second brain. It has its own completely autonomous nervous system, and from the osteopathic point of view, all gut problems, even inflammatory diseases, well, it's a muscle too, right? A muscular organ.
Smooth muscle tissue.
Yes, smooth muscle tissue, just like the gallbladder, is also a muscular organ. Yeah? So tell me, from the osteopathic perspective, severe inflammatory diseases, everything from enteritis and colitis to constipation, diarrhea, bloating, and so on. Every patient who comes to see me has some kind of gastrointestinal issue, mostly with the intestines. Of course, naturally a result of what happens higher up, right? Well, that's just my logical reasoning, you know. But from the perspective of your work, what can you share or recommend here?
If you look at it, the gastrointestinal system has many different sphincters, right? Starting from the upper esophageal sphincter, then the lower one, then there's the pyloric sphincter, then the sphincter of the gallbladder, the sphincter of Oddi, and then the ileocecal sphincter between the small and large intestines. And the digestive tract itself is made up of smooth muscle. In other words, these are muscles. And there are waves of peristalsis, right, which are responsible for moving the digestive contents along the tract. And because of the tension we talked about, any kind of stress, whether physical or emotional, it can lead to spasms of these sphincters. And they can spasm for a short time, or they can stay in spasm for a long period. And if a sphincter stays in spasm for a long time, it disrupts the passage of movement inside the digestive tract, or it can lead to backflow, like acidic contents getting into the bile environment of the esophagus, or the opposite, when bile and pancreatic juice aren't released. If this sphincter is tense, then when bile mixes with pancreatic juice, it starts to cause inflammation of the pancreas. An inflammatory process begins, meaning that the bile and pancreatic juice themselves start to erode the pancreas and disrupt the function of the gallbladder. As a result, the absorption of vitamins like A, D, E, and K is also disrupted, and a different kind of microflora starts to develop. Plus, if we look at the ileocecal sphincter, if its function is disrupted, then fecal matter with pathogenic microflora can, again, enter the small intestine.
What shouldn't happen?
Yes, so everything is supposed to work properly, like a system, like a piston moving through different levels. When this process is disrupted, problems start. That's why, from an osteopathic perspective, and on top of that, there can also be parasitic infections.
That's a whole separate topic.
Exactly. So, in order to have proper digestion, absorption, and to prevent inflammation and pathogenic microflora, we need to make sure this system works efficiently and steadily. That's why all the sphincters need to open and close properly. And peristalsis, the movement of food, should proceed smoothly without stopping anywhere. And the last sphincter, the anal sphincter. So things like constipation and related issues are also part of this. All of this is connected to dysfunction, nerve tension, blood vessels, and stress. And osteopathy works with these issues through this exact approach.
We've already touched on the topic of hemorrhoids. I can't help but ask again, because this topic is really popular. It's one of those subjects people don't talk about. But at the same time, my podcast with a proctologist got a huge number of views. So it's an issue that affects almost everyone. For example, women start suffering from inflamed hemorrhoids during pregnancy. It's women after childbirth, when they're pushing, right? It's also men who sit a lot. By the way, for men, it's also a super common issue. Anyone with a sedentary job, and even certain nationalities are more prone to hemorrhoids. What can you say about this? You mentioned something interesting about the liver.
Yes. Well, first of all, it's definitely the sedentary lifestyle. Second, trauma, any kind of trauma, even just from toilet paper and so on.
Well, let's talk about sitting. Sitting on the toilet for 5 hours with a book or scrolling through Instagram.
Again, because your large intestine isn't working properly, all of this definitely makes it worse. On top of that, you have to add that hemorrhoids develop, and the venous outflow specifically from the rectum goes through what's called the portal venous system. What is the portal venous system, in simple terms? That is, all the blood, the venous blood from the abdominal organs, goes through the liver. So all the blood from the abdominal organs and from the rectum passes through the liver. If there are problems with the liver or higher up, if there's an issue with the diaphragm, this leads to congestion, fluid buildup in the intestines, and there will also be congestion in the rectum. And those venous caverns there, yes, under the influence of a sedentary lifestyle, will simply start to expand.
And hard stools, right?
Yes, and they will become deformed. So, mechanical irritation, plus a sedentary lifestyle, general congestion, and also impaired venous blood flow through the liver, through the intestines and the liver. Again, people who have liver problems often have enlarged abdomens.
Enlarged, right? But the thing is, so many people suffer for years. They keep using these suppositories, applying these ointments, but they don't help. Yes, they go for surgery, have those inflamed hemorrhoidal nodes removed, and it only gets worse. The problem isn't solved. So, I do support going to a proctologist. I also believe, by the way, that everyone should get a colonoscopy at 35, because I see all sorts of, well, not good things, polyps, you name it. They find all kinds of stuff, right? But there are still some additional methods, right? Besides just.
Of course, that's important to keep in mind, because any suppositories only provide symptomatic relief. Of course, if there's some kind of mechanical irritation, then to reduce inflammation, yes, you can use them. But you always have to think about the cause, why it actually appeared in the first place. And the cause might be somewhere else entirely. Like I said, it could even be a problem with the liver. So check your liver. Maybe you have liver swelling or fatty liver disease, or maybe your diaphragm is in spasm. Pay attention to how you breathe. Take a deep breath in and out. Maybe your diaphragm isn't working properly.
So explain to us, so we can understand, what does a spasm mean? How can we tell if our diaphragm is in spasm? How? You can feel the energy in your body, but we're just regular, down-to-earth people.
You don't even need to feel any energy for this. First, just pay attention to how you breathe. For example, if when you inhale, you feel the urge to lift your shoulders. So when you inhale, notice whether only the upper part of your chest expands, or if you also feel your ribs spreading out to the sides. In other words, your whole chest should be expanding. Also, pay attention to whether you're artificially sticking your stomach out. Artificially pushing your stomach out is incorrect. Breathing only with the tops of your lungs and lifting your shoulders is also incorrect. So your breathing should make your ribs move outward, as if they're expanding to the sides and even lifting up a little. And when your ribs are fully opened, this wave of breath continues downward and inflates your pelvis. So see if you feel that during exhalation, or rather during inhalation, your diaphragm opens up And after that, your belly starts to inflate involuntarily without you forcing it. And you even notice that your pelvic floor starts to open up and stretch. That means your diaphragm is working properly. So ideally, it should work like this. The ribs should move outward, the diaphragm descends and pushes all the internal organs downward. Because of the increase in intra-abdominal pressure, the belly expands a bit, and this pressure goes downward, stretching the pelvic floor. So if the wave reaches the pelvic floor and you feel it expanding, that's great.
Oh, so could you please explain the difference between men and women when it comes to breathing types? And what mistakes do we make?
Actually, I think the principle is the same for everyone. That is diaphragmatic breathing, again, what I'm talking about. So we're not breathing with just the tops of our lungs, and we're not just inflating our stomachs. So our main task is, we can put our hands right on the lower ribs. And when we inhale, we should feel the ribs expanding outward.
So
And the greater the amplitude, the better.
this is chest breathing.
This is diaphragmatic breathing. That is, when we specifically engage the diaphragm. Because you can, like me, for example, look, I can block my diaphragm. Here, it's tense, for example, and now I'm breathing.
Not with a full chest.
Or I lift my shoulders. Often, when patients come to me, I do a diagnostic check and ask them to breathe while standing. But normally, the breathing wave passes through the chest, goes through the diaphragm, the thoraco-abdominal area. And then, even visually on the videos I make, you can see the lower back and even the pelvis start to stretch as if expanding. So the wave reaches all the way down to the pelvis. If there's tension in the thoraco-abdominal diaphragm or in the spine, it looks like the person just lifts their shoulders, and from the thoracolumbar junction down, everything stays completely still, like a solid block. In other words, during inhalation, you should see your whole body start to expand. If it's in such a tense state, it means the diaphragm isn't working properly.
You know how they say women mostly breathe with their belly and men with their chest?
As for me, the principle is basically the same. It's the mechanism of diaphragmatic breathing.
Well, for example, I make myself breathe with my chest. If I don't control.
You mean down here, right?
Yeah, if I don't control it, I start breathing with my belly.
That's not correct.
That's what I'm talking about.
These are just stereotypes. So, inflating your belly or raising your shoulders, that's not the right way. So the focus should always be right here, from the xiphoid process, from the solar plexus area, feeling how the ribs should expand outward. That's what diaphragmatic breathing is.
All right, last question, and then I'll let you go. Headaches are such a common problem and a frequent symptom for patients who take painkillers by the handful. And not just regular painkillers, but also special anti-migraine medications.
Those can trigger headaches too. It creates a vicious cycle.
So tell us about that.
It's a really interesting topic. To put it briefly,
Like everything.
well, in osteopathy, and generally in my own practice, I've reached a point where after just a few sessions, even headaches that have bothered someone for 10 years and so can often be relieved. These are people who have taken all sorts of medications, even gone to various neurology centers, pain clinics, and so on. Not in every case. I can't give a 100% guarantee, but osteopathic techniques really do work wonders. Because if you really get to the root cause, the etiology of the headache, first of all, you have to distinguish. There are headaches and there are migraines. Tension headaches are often either cervicogenic, that is, originating from the neck, or of cervical origin, yes, headaches that come from the neck. They're connected to muscle tension and impaired venous outflow. That is, first of all, a violation of venous outflow, because the venous sinuses in the skull pass through the back of the head. This is exactly where the occipital area is. This is where the venous sinuses merge, and then, right here, the venous vessels exit through an opening. Right here, through these small openings, the jugular foramina, the jugular veins exit here. That's it. And when the muscles in this area, in the occipital region, become tense, it disrupts venous outflow from the skull, first of all. This causes congestion, venous stasis inside the skull, and the venous sinuses. These venous sinuses can also affect the dura mater, which, under pressure, can stretch and create resistance. It has a lot of pain receptors, and the tension in the neck muscles, plus the pain receptors in the dura mater inside the skull. This causes headaches, tension, and a feeling of heaviness. Heaviness and basically everything that comes with it. Migraine is a slightly different story. It's kind of related to this, but unlike a regular headache, there's also this aura. And these are extremely intense headache attacks, when you lose your ability to function. And according to modern research, it's mostly about women who are affected to this, because hormonal changes related to the menstrual cycle. But it's also connected to the trigeminal nerve. The trigeminal nerve and the blood vessels in the head. And that's exactly what osteopathy works with. It can work with the trigeminal nerve because the trigeminal nerve, among other things, innervates the jaw muscles, the face, and also the membranes of the brain. Plus, it's involved in innervating the blood vessels as well. And in my understanding, from what I see, when people come to me with migraines, headaches, especially migraines, their skull is very rigid. That is, the skull becomes very stiff. It's like, in the medical history, there was some kind of trauma, starting from prenatal or birth injuries. Maybe you had something like that, right? Plus, there could have been some kind of head injuries or concussions. And when puberty comes for a girl, these hormonal swings can further intensify this effect even more. Really strong stress can also cause it. What does this lead to? If there were injuries, this leads to tension in the skull bones and tension in the dura mater. It has a lot of pain receptors. Plus, there is a vascular spasm. So, in the mechanism of migraine, the very first thing that happens is a strong vascular spasm in the head, which is why things like aura and so on can occur. Also, due to the activation of the trigeminal nerve and vascular spasm, I'm not sure which comes first. Maybe the trigeminal nerve affected the blood vessels and caused the spasm, or maybe the vessels spasm because of some other factor. But this leads to the presence of certain inflammatory neurotransmitters. They start to be released into this area, where the vascular spasm is happening, and an inflammatory reaction of a vascular nature begins. So, in the area of the blood vessels, an inflammatory reaction occurs. Then the vessels actually dilate, become more swollen, and this causes a severe migraine. So, basically, the cause is a strong vascular spasm, dilation, and inflammation in this area. And if you work with the trigeminal nerve, if there are vascular techniques where you can work with the blood vessels, with the bones of the skull, with the dura mater, then you can influence the underlying causes so that the headache goes away. There may also be psychosomatic factors, but I'm not a supporter of the idea that if you just find one emotion, everything will go away. Sometimes that happens, but again, a comprehensive approach is needed. Plus, from the perspective that, if a person, usually people who suffer from migraines have been on medication for a long time, and often on quite strong medications. I can't remember how they are called, but there are medications that actually trigger headaches themselves. That's why it's very important to get off these medications as well, because if you just keep taking them, they also provoke headaches.
Thank you so much, dear friends. I'll leave links to Alice's social media accounts. This amazing doctor, a truly bright person, and very sincere and kind. You really mean what you say. It's written all over your face. When I first met you, honestly, it was obvious and clear that you're exactly the kind of doctor I would go to, because you just radiate positivity. It's true. And I'll leave a link to his educational platform, so check it out. There's actually a lot of deep techniques there. When I was preparing for the podcast, I thought, oh my God, if only there had been this much accessible information 20 years ago, people would probably be much healthier, happier, and maybe even better looking. Thank you so much. You shared so much with us today. But again, I feel like this is such a bottomless topic. You could talk about it forever. So thank you very much, dear friends. Please write to us about what discoveries you made during these 3 hours, what interesting things you heard or learned, what you'll take with you into your life, and what you'll use in your own life. And try Alice's courses, learn from him. For those who want to look many years younger naturally without dangerous interventions and to have sense of well-being should go to your educational platform Mind Body Face.
I'm grateful to you for inviting me to this podcast. And yes, I have educational platform called Mind Body Face, where thousands of clients all over the world can practice online lessons as daily routine, 6 weekly workouts to look young and stay energized naturally. On platform, there is library with courses for different areas. And you can gain this knowledge for yourself. Besides regular rejuvenation membership, there are courses for women's body, from headaches, for vision, and so on. In other words, you can learn how to rejuvenate yourself, how to improve your overall well-being, posture, and face. You will discover how easy it can be to make self-care a natural part of your daily routine. You'll be provided with daily quick and effective methods and exercises to look younger and boost your energy.
Thank you so much.
Thank you very much.